Regina Zick is an acute care occupational therapist at NYU Langone Health, where she brings her expertise and compassion to the fast-paced hospital environment. After earning her bachelor's degree in psychology from the College of New Jersey in 2014, Regina obtained her master's degree here at SUNY Downstate in 2018. Currently, she is furthering her education by pursuing a post-professional doctorate at NYU Steinhardt with a commitment to client-centered care and inclusive practices. Regina strives to make a meaningful difference in the lives of her patients every day. Regina Zick. Thank you.
Thank you, Dr. Brewington, for that lovely introduction. So Dr. Sabari was the chair of Downstate when I was here, so it's aging me now. So my name's Regina Zick, and I am Downstate alumni class of 2018. So it's nice to be able to speak to all of you because I was in the seats that you were once. And it feels like a lifetime ago, but also feels like yesterday, just a little bit. And today I wanted to share with you a bit about my journey since graduating from Downstate. And to do so, I'll share 5 lessons I've learned. So without further ado. So first, the lesson that I learned is to use your background skills to leverage your strengths. Downstate intentionally chooses their graduates from all walks of life, whether that be from previous careers, family experiences that sparked an interest in OT, or unique interests and hobbies. So prior to embarking on my master's at Downstate, I worked in the construction field via AmeriCorps, which is the domestic version of Peace Corps. And during my time in the nonprofit sector, I instructed unskilled volunteers from demolition and drywall to finishing work like trim and tile work. And you might be asking, Regina, how does this connect to OT at all? But beyond the technical construction skills, I also hone leadership skills, like managing worksite safety, delegating tasks, monitoring volunteer progress, and the importance of problem-solving skills. So I often find myself drawing parallels between teaching volunteers and educating my patients about safety awareness. And although my background surprises patients when I decide to tell them, I do see similarities between the nonprofit sector and the OT community because we have a shared focus on assisting others and a big emphasis on adaptations for aging in place. So how did I leverage these skills to strengthen my OT career? I bring these skills to work with me every day. So I work in the acute care setting at NYU Langone Health, and throughout the years, I've gained competence in every patient population and unit that my hospital has to offer. In acute care, our job involves a lot of triaging patient needs, and the ability to triage on a construction site definitely comes in handy when it comes to triaging my caseload on a daily basis, like you will one day. How else did I leverage these construction background skills? I drew on my previous experiences and my current career during guest lecturing at NYU's rehab class when we talked about the importance of modifying client environments in a prefab way or a custom way, and ultimately increasing safety and accessibility. And finally, I leveraged my background skills to break out of my OT bubble comfort zone into the emergency management career. So I ran 2 nationally based webinars for emergency managers regarding the importance of inclusion for those with access and functional needs. And we focused on before, during, and after a natural disaster. So while moderating the panel was nerve-wracking since the audience was from all around the country and I had to gain some expertise outside of my realm, it was also kind of invigorating to be able to collaborate between these professions so seamlessly. Because personal readiness is an area where the OT community and the emergency management community can really find shared focus on the importance of inclusion and safety. And these collaborative efforts and interprofessional work were invaluable learning experiences for my continued growth. And I never would have thought to even embark on these endeavors if it wasn't for my efforts to use my background to my advantage. So I implore you, find some background skills before Downstate and during Downstate and use them to leverage your strengths. Okay, so lesson 2. I knew this while graduating, but it cemented over time for sure, that we chose a career of lifelong learning, and lifelong learning is just imperative. This learning can be formal or it can be informal. I took this lifelong learning maybe a bit too literally when I found myself applying for an OTD at what Professor Sable likes to call the expensive school, or NYU. We all know that. So I'm so sorry, Downstate. It did not exist yet for the post-professional degree, but I am very thankful for tuition remission programs. So I'm happy to report, it's a very big week for me, that I successfully defended my OTD 2 days ago, and I'm walking in graduation next month. Oh, it's very relieved. So ultimately, I chose to obtain this OTD because of a concerning trend that I saw across the different hospital units. And this was the return of the frequent flyer patients, right? Patients that return due to preventable injuries like recurrent falls or non-compliance of medical surgical precautions. So my doctoral portfolio is called Beyond the Safety Basics, OT's role in promoting safety from the hospital to the community among adults. And one term that I find myself saying in my career, maybe a bit too often, is that I want to make safety sexy. So we all deal with safety, right, in our OT careers, and we deal with this in our everyday life. But it does not have to be mundane or routine, because by making safety engaging and appealing, we can connect to our clients or patients, our colleagues, and our future OTs like you guys. And throughout this journey of lifelong learning, I tried to spin patient safety in an exciting way. So also in an effort to be a lifelong learner, I actively learn from my caseload every day that I walk into work. I work primarily in the ICU. And just yesterday, for example, I coordinated getting out of bed for a bilateral lung transplant post-op day 1. And of course, with the help of the nursing staff and the respiratory therapists. And this may sound complicated, because it is. This patient was still intubated, he had 4 chest tubes. We have patients that are not medically stable with a ton of lines and drains and tubes attached to them. But even though there's lots of more moving parts, the aim is to facilitate mobility as early as safely possible. And this is what makes our job so exciting, and it's definitely never boring, I promise you that. I have to use my clinical reasoning skills on a daily basis, and I have to ask questions. So OT is a challenging career, but again, I am never bored. And some of you will choose to work in acute care, but others will choose to work in different settings. Nevertheless, being open to continued learning is imperative every day you decide to walk into work. Whether you continue your journey of lifelong learning formally through another degree or through continuing education classes, or informally through just daily, evidence-based practice and discussions, I want you to be prepared for continuous lifelong learning every day. You will. All right, the next lesson that I learned is that problem solving to fill gaps in knowledge or research will set you apart from the pack. You've already practiced identifying meaningful projects through your master's projects, but I want you to remember to bring this skill into your everyday life and career. Don't be complacent when you notice a problem, but instead get creative. For example, I created a DME resource for durable medical equipment. Basically, our hospital was in the process of changing, where OTs were now allowed to order equipment and not PTs ordering everything like it was before. I have a lot of thoughts about that one. So we've left our OTs scrambling a bit for information because we didn't have a guide on considerations for ordering different types of equipment. A lot of us haven't really talked about that since our masters. And we didn't really have potential pricing guides when it came for our patients asking questions, right? If they wanted to order through our third-party medical supplier that the hospital provided, or ordering privately themselves. So I took this gap in knowledge and created the helpful resource for my team. Like the DME resource, I also completed a systematic review which stemmed from a gap in knowledge that I noticed in my everyday practice. You didn't think that you were going to have to write another thesis, but it might come to you one day, like it did for me. So COVID caused visitor policies in my hospital to constantly evolve, and all hospitals. And basically, we went from having visitors in our sessions, and we were able to educate them, to completely restricting visitors during the pandemic's peak, and then allowing visitors during only certain hours, like the afternoon, for example. But more than half of my patient encounters occurred during morning hours when visitors were prohibited. And this policy shift really got me thinking about what the safety implications could be when visitors were not allowed or family members were not allowed in my OT sessions. What do you think? Were we all just winging it during COVID? Because I think so. So I decided to investigate the effective methods for service delivery approaches for pre-discharge caregiver education on ADL performance. And I found that hands-on skill training and a combination of hands-on skill training and written resources really found a low strength of evidence. So it really got me thinking a little bit how I choose to do my caregiver education with my patients. So overall, I always want you to dig deeper and ask questions. All right, when you see any gaps in knowledge or research, a simple solution can sometimes make a very big difference. And trust me, this will set you apart from the pack. All right, I have some Downstate pictures here. So next, I want you to trust the knowledge and skills that Downstate has taught you, okay? During your fieldworks and early stages of your career, imposter syndrome is real, and that is okay, don't worry. As OTs, we don't sit at a desk and we don't work with Excel power, like spreadsheets, but instead we work with people. And while working with people is wildly rewarding, it's definitely not straightforward all the time. So take it from me, most of my patients don't really want to be in the hospital, but it's my job to combat this and really acknowledge their fears and their uncertainties and partner with them to get them back in action. Once you start fieldwork and start studying for the MBCOT, you're going to realize that the information that you gained over the last 2 years is all still there. For some examples, I often find myself thinking about Dawn's palpation lab when I'm performing scapular mobilizations with my patients. I definitely regularly draw upon Professor Staples' pelvic clock exercises when I'm working with a patient sitting on the side of the bed and we're performing dynamic balance exercises, and also when we're performing diaphragmatic or pursed breathing. When I see patients a day of or even a day after a stroke or neurological injury and they have a hemiparetic upper extremity, you better bet I am utilizing Dr. Klein's positioning strategies, and I'm also talking to the nurse and talking to the patient's family about these positioning strategies to increase carryover. And finally, when I got the opportunity to get out in the community during my career and perform some fall prevention community audits in a naturally recurring retirement community, I was definitely thinking of my community practice project with Dr. Thomas. So overall, feeling imposter syndrome is completely normal, but know that Downstate has provided you with a very excellent foundation, and you'll have the skills to succeed, I promise. Okay, so last but not least, my last lesson is to lean into the uncertainty. Easier said than done. I've already established that we work in a very challenging field, but we embrace that. One beautiful thing about our career is all the different possibilities that all of you will end up in. Think about the diverse settings. We have adult acute care, we have peds acute care, inpatient or subacute rehab, we have long-term care or skilled nursing care, outpatient hand therapy or outpatient neuro. We have vision specialists, and OTs have mental health settings or school systems like the DOE, right? Sensory gyms, early intervention, the list can go on and on. But don't worry, the path that you choose will be malleable. I've had many colleagues switch from adults to peds, inpatient to outpatient, and vice versa. The dynamic nature of our career allows constant change and, again, is never boring. Speaking of never boring and having to lean into the uncertainty, when I was a year into my career, COVID hit. And needless to say, it was very challenging and scary to be on the front line as a brand new baby OT. But I decided to lean into it because, frankly, I had very little choice. So I'm stronger for it, though, right? I had to adapt on an individual basis as the CDC had ever-changing guidelines on what we were supposed to do. And we also grew stronger as a team because we had to triage PPE needs and our priorities as an OT department. And this taught me to lean into the uncertainty after COVID, too, because whenever possible, within reason, I try to say yes to all new opportunities, because I'm here, aren't I? For example, I became the point person for my department's gender affirmation population. Other than the basics of being an ally, I didn't know a whole bunch about working with the transgender community, especially where OT fits into the mix. But I gained a passion for working with this population, and I worked closely with the plastic surgery team to edit early mobility protocols, I was able to create some patient education resources, and I started training my peers for post-surgical care for gender affirmation surgeries. And last year, I was able to do a poster at AOTA all about the OT's role working with this population and the importance. So, within reason, I encourage you to say yes whenever possible and lean into the uncertainty, because you'll never know where this will lead you. All right, I can go on and on forever about why I love OT, but then we'll never get to your presentations, so I'll wrap it up, I promise. So here are some takeaways and advice that I give you moving forward. 1, leverage your unique backgrounds and strengths. We all have them, you just need to find them, okay? 2, love the dynamic and exciting nature of the career that you chose, and really embrace lifelong learning. 3, strive to fill gaps in knowledge or research, because we can't be complacent with the status quo. 4, trust that Downstate has given you the foundation that you need to succeed. You have all the skills that you need, you just need to apply them. And then lastly, lean into the uncertainty. Easier said than done, but I promise this will make you open to new opportunities. So thank you so much for inviting me to be your keynote speaker, and congratulations to all of you for your upcoming graduations and your master project presentations.